We are here with the President of Neonatal Turkish Society, Esin Koc, and we want to ask her, is neonatal jaundice an increasing problem?
Yes, in the last 10 to 15 years there is an increase in the incidence of neonatal jaundice, and this requires a rethinking of our approach to these babies. And although most of them are benign conditions, a small part may have neurotoxicity and clinical findings that cannot be reversible. So the doctors and the parents should avoid this problem, should be aware of this problem, and timely diagnosis and treatments. These are main points of neonatal jaundice.
So does it need a new approach?
Yes, we should be more careful, and we should be careful and use guidelines of neonatal jaundice. And before discharge of these babies, we should be sure that these are not high-risk infants for indirect hyperbilirubinemia.
So what can we expect for the future?
For the future, all the doctors should be aware of the hazardous side effects of neonatal jaundice, and especially for breastfeeding infants. Actually, it's a good news that the incidence of breastfeeding is increasing, but the mothers should have consultation about lactation, and the doctor should be they should know that the baby is taking enough amounts of milk before discharging from the hospital. So these things, and especially high-risk infants with blood incompatibilities, these babies should be followed very closely.
Okay. Should all the countries use the same guidelines in retinopathies?
Yes. Currently, there are more tiny babies who are surviving. So the mortality of prematurity is decreasing, but there are still morbidities like retinopathy or prematurity. And we should use guidelines to identify these babies, because ROP is the very important etiology in blindness of children, and it can be avoidable. So diagnosis and treatment, but timely diagnosis and treatment, these are important things, and because of that, countries have their own guidelines to follow these babies. But as all the countries have different properties, some of them are developed, some of them underdeveloped, and with different incomes. So for example, in underdeveloped countries, more mature babies have retinopathy or prematurity. So in these countries, more mature babies should be screened comparing to the developed countries. So all the countries should have their own data, and according to their national data, they should have their national guidelines.
Okay. Thank you very much.
You are welcome.